You guys, I feel like crap. Oh my God, I feel like crap. Oh. But I gotta get better because I gotta get ready to start taking these labs and surgery around the corner. And I cannot have COVID in my system, okay? So I'm just congested and I just keep coughing or whatever. I don't have a fever and I don't have diarrhea or nothing. It's just freaking irritating. And I feel like I just want to sleep all day. So I just thought about taking these vitamins. Y'all seen I posted in my community tab. I'm getting ready to head to go get my B12, get my B12 shot. So yeah, let me get up and let me get to the grocery store too.
Do you want the bikini body back? Stop hiding that belly. Get rid of it. 3 reasons to consider doing a tummy tuck with me. Hi, I'm Dr. Joel Shanklin, plastic surgeon here in Miami. I have over 30 years of experience in plastic surgery. Number 1, we're going to get rid of the excess fat from the lower abdomen. We're going to get rid of that bulge in the upper abdomen. The bulge is usually caused by the 9 months of pregnancy that has stretched the abdominal wall apart and brought those muscles apart. Number 2, we're going to give you that hourglass waistline by usually adding liposuction around the flank to give you that appearance going above the hip to give you the hourglass back you had before pregnancy. Number 3, I use Exparel in my patients that have an abdominoplasty or tummy tuck. What it is a medication that will inject along the areas where we've tightened the muscle and where we've tightened the fascia. That's going to give a excellent amount of pain control post-op for you. It allows our patients to get up within the next day or day after the surgery and walk around with a significant reduction in the amount of pain. It will really help your post-op recovery. It's time to get back that bikini body. Click the link in bio and come see me at Vixen Plastic Surgery.
I feel like falling in love. I'm in the mood to fuck something up. Better fucking something. I need some drink in my cup. Hey, I'm in the mood to fuck something up.
Okay, let's jump right on into it. Okay. Hey, it's your cousin Krystal bringing you another video. Y'all, I broke this nail and I just broke this nail after I just went and got this nail fixed and this nail fixed. So guess what? It's time for a refill. Well, no, it's time for a full set. But anyway, so y'all know I do a lot of talking with my hands. So don't be trying to come for me with my missing 2 nails. Okay, so anyways, I'm just playing, y'all. I don't know where to start. First off, go ahead. Y'all know I'm crazy. Go ahead and put a thumbs up for your cousin. I got this from my girl Chrissy. It's free and it don't cost you nothing, okay? Go ahead. Go ahead and put a thumbs up for your cousin. For real. If you are new here, thank you so much. I do recognize that I have some new family members. We have some new family members. We have some new cousins. And I am greatly appreciative to everybody that is new to my channel. Trust me, you're going to love it here, okay? On my channel, not only do we like educate each other on proper garments and how to research doctors and the underlying classifications of board certifications and stuff like that when it comes to these different plastic surgeons, but we also discuss on my channel just supporting each other and just collaborating and being, it's okay to be emotional vulnerable to people that's willing to support you as well as advocate for you, okay? And that's what I am. I am a plastic surgeon advocate, and I advocate for all of my plastic surgery cousins, dolls, whatever, okay? And like I said on my last couple of videos, my platform is available to anybody, okay? Anybody. I don't care if you LGBTQ, lesbian, trans, whatever you want, whatever you are welcome here, okay? No discrimination, okay? Because we, at the end of the day, we all here for a purpose. We all here for support. We all here to learn new things. We all here to learn from each other, educate each other, as well as be very informative when it comes to this surgery journey, okay? Now, I'm not going to hold y'all long because I got to get up for work, okay? First off, before I start, Happy New Year! Y'all know I can't wait to get my breast done. Be prepared to be sick of me. Be prepared to be sick of me. Okay? Be sick of me. Baby, first, before we even get up into this video, y'all know I'm about to be a Shanklin doll, okay? I'm about to be a Shanklin doll. Oh, but the crazy part is, like, y'all, why am I so nervous? Like, why am I so nervous? I don't know. It's not because I'm about to be a Shanklin doll. I feel like it's because, like, I always wanted to get my body done, okay? I always wanted to get my body done. But, truth be told, I kind of feel like I should have got my breasts done first, if that makes sense. I don't know. Because I always wanted more than enough, okay? I always wanted more than enough. And when I talk, like, I talk with my hands, but when I'm like, I don't know, like, I just be wanting to feel free. Like, I don't know, I just want some enhancements, okay? And truth be told, it's a lot of people that be wanting my breast size, and I'm like, just like, why? Why, cousin? Why you want these? No, you don't. No, you don't. Okay? Let me see. I'm a C cup. I think I'm a 34C. 36. No, I'm a 34C. Yeah, I'm a 34C cup. I want to enhance my breasts to a D. What did I say? D28? D. Oh my God, I gotta go back and look, cause wait a minute. But anyways, basically, let me tell y'all, with the saline, that's why I'm glad I'm not getting saline, because with the saline, I'm hearing that you can go as big as you want to go. No, I don't want to go as big as I want to go. I want to go as big as what's comfortable with my body structure, as well as what looks good with my body structure, if that makes sense. Like, I want enhancements. I want a lift. I want implants. I want above the muscle. I want, Dr. Shanklin, I need for you to just bring it, okay? So one of my cousins said that when she talked to Vixen, they told her that the Lipo 360 is included with the back buffalo fat. And I was like, it's included with the back buffalo fat. Okay, so if that's the case, they had to not have took enough out of my back. I'm just saying. Like, no, y'all, no. No, they didn't take enough out, okay? They did not take enough out. So anyways, like I told y'all, my total cost is, I think, $4,300. I think $4,300. I think $4,300. And I gotta go back and look at my contract, y'all, because y'all know I like to be honest with y'all. But I think it was $4,300. But I kind of got on like a little special, and then y'all know I had got that little deposit from 2 years ago transferred to Dr. Shanklin. Ain't God is good? Won't he do it? Yes. So, yeah, with that being said, yeah, that's what happened, cousin. So, needless to say, it was $4,300. That's including my back buffalo fat. She only charged me $500 for that. But my thing is, matter of fact, I'm going to get in touch with my coordinator this week, because I want to find out for the back buffalo fat. I know it's including like right here, the bra area, as well as my back area, because I don't want no rolls in my back. I want my back to be flat as a tortilla, okay? But she said, like I said, to add Lipo 360, which is going to be included with the buffalo fat. And y'all know I love how Dr. Shanklin be silhouetting these dolls. Oh, straight off the table, they be flat and they be swollen. How you flat and you swollen, cousin? Oh, baby, he... Yes. So I'm sorry, y'all. I had a moment. Like, I know if y'all follow my Instagram page, y'all see on my story, like, I'm just tagging Vixen all day, like tagging, sharing their stories. That's why I had a few people inbox me talking, do you work for them? No. No, I don't work for them. Girl, look, I wish, like, Vixen, y'all need a ambassador? Y'all need an ambassador? Because, baby, I'm here. Hello. But anyways, y'all, so what I was about to say. So, yeah, Dr. Shanklin be doing what he doing. Dr. Triggs been doing what he doing. And Dr. Cannon been doing what he doing. So, getting back to, I really feel like that I want to do another round of Lipo 360. Why not? Okay, I think to add on a Lipo 360, I believe it was no more than an extra between 12 and 1500. So that's minus the 500 from the 4200. So it's gonna end up being like 56. I want to say something like that. But that's my breast. That's my whole augmentation. And it's Lipo 360. So yeah, I'm still debating. Okay, so now since that's out the way. Okay, also I forgot to tell you guys. So your cousin is getting ready to start a cousin travel concierge services. Yes, I'm about to get ready to start a concierge services. I already have 2 clients. Two of my cousins already booked me. Well, one girl booked me. She just waiting to pass her labs, and then she gonna pay her deposit. So basically, with my services, let me tell y'all. I'm like so excited. Like, this just means so much to me. Like, I was just laying out in the bed the other day, and I was just like, a lot of cousins been inboxing me looking for recovery houses, looking for Airbnbs, looking for good hotels. Then they're looking for nurses. They trying to configure out their finances, how much this gonna be, who gonna do this, who gonna do that. So anyways, I want to be the first to come and tell you guys about the services that I'm getting ready to offer. No, I'm not clinically licensed, but yet again, if it was to be an emergency, I would have to do the same thing that a nurse would have to do, as well as what Vixen would have to do if something happened to you on the table. 911. Okay? So basically, I want to get contracts drawn up and everything just because of precautions, and I want to have a disclaimer in my contract as well. It's not really even about the money, non-refundable deposits, nothing about that. It's about the clinical side of things, heart rates and vitals and your heart and everything. Like, I'm not playing, okay? I'm not playing. So basically, we're going to think positive on my channel, okay? Because, baby, we all survivors. So basically, with my services, it's a 3-day service. I haven't thought about doing longer than 3 days, but so far I'm doing 3 days. Right now, my fee is only $800. $800, yeah. And it doesn't matter what type of procedure you're getting done. So basically, let me tell you what I offer that a lot of different people really don't offer, or they do offer, but you don't get them. Because like I said, I stayed at a few recovery houses, and what was on the contract I did not get. So make sure everything that's on your contract are underlined of everything that you're supposed to be getting, including like your supplies. Make sure that you're getting them, because that's what you're paying for. Okay, that's what you're paying for. Honestly, it depends on where you go, because at my first recovery house, I just felt like I had a babysitter. I felt like I had a babysitter. I paid almost $1,000, and the food was salty. They didn't make me walk. They didn't ask me to walk, to get fresh air. They didn't. Oh my God. If this is your first time, make sure you asking a lot of probing questions before you pay your deposit, okay? So anyways, let me tell you about Cousins Travel Concierge Services. Okay, so basically, it dawned on me, and I was just like, you know what? This is my calling. This is my calling. Okay, so basically, I was just like, I want to it's not just about the money, because like I said, I'm only charging $800. So basically, with my fees and prices, if you're getting an Airbnb, because of course I cannot come with you to a recovery house. So basically, if you're getting an Airbnb or you're getting a hotel, basically I will be there 3 days with you, out and for 24 hours. So make sure if you're getting a hotel room, you got an extra bed for me. My flight should be covered. My round trip flight should be covered, as well as my fee is only $800 compared to, okay, yeah, they are licensed, but anyways, a lot of nurses don't have to really charge what they charge, and they not doing what they supposed to be doing. But needless to say, they are allowed to charge what they want to charge, and if y'all choose to pay $1,500 24 hours, then that's on you. You got those coins, that's your money, okay? So anyways, so only thing that I'm charging is I just need a bed, of course. So I want to be with you 24 hours a day. So I will arrive at pre-op on pre-op day, to make sure everything is good to go. Make sure you have everything. We have all the food and everything. We go by the grocery store, so I can prep the night before. Make sure you up on time for surgery. If you are religious or spiritual, we're definitely going to say a prayer. Not only that, I want to be a confidant. I want to be not just a chaperone, not just a concierge service, but I also want to be that #1 support system that's right there by your side. If you have any last minute concerns, let's talk about it. If you want to just vent, or if you just want just somebody to talk to, I'm there for you, okay? 24 hours. Like I said, pre-op, day of surgery, we getting up, you taking your bath, doing whatever you need to do. Your stuff is already gonna be laid out. I'm gonna make sure all your stuff is already laid out the night before. So in the morning, you just put your gown on, your compression socks. Even though they're gonna give you compression socks, but I'm not letting you walk in there on no cold floor, because it's gonna be cold, okay? And then when you change out your clothes, I'm gonna get your stuff. I'm gonna have a little bag. I'm gonna confiscate your stuff, as well as I'm going to get your I'm going to get your prescription, from them or whatever. I'm gonna get your scripts. So while you're in surgery, I'm gonna go ahead and try to pick up your prescriptions, because I'm sure you're gonna be in surgery 2 hours. So meanwhile, I'm going to ask them at pre-op what medication it is that they are going to prescribe you, whether it's Narcos, Tylenol 3s, whatever. I'm going to go ahead and start calling around pharmacies. I'm going to call at least 5 to 6 pharmacies and see, do they have a lot in stock? So that way, the next day, hopefully I can get in there and I can go ahead and get everything it is that you need. You're pretty much already going to have your Gatorades, your waters, all that stuff already there the day before, because we're going to get that right after we leave pre-op. So like I said, day of surgery, I'm going to provide transportation coming to pick you up from surgery. I'm going to bring you back. I'm going to have your prescriptions already. You're going to take your time. We're going to get to this inside of this Airbnb. I'm going to let you relax some. Go ahead and already have your jug and everything prepared. Bedside, everything already prepared. I'm not going to administer your medicine because I'm not a licensed administrator, but I'm going to put them in your hands and you're going to give them to yourself. I'm going to read them to you, what you're taking, as well as I'm going to log. I'm going to log everything. I'm bringing basic essentials with me. A thermometer, a temperature thermometer. I'm bringing a first aid kit. I'm bringing Lysol wipes, alcohol pads, gloves, sanitation, as well as the next day after you go to post-op. I'm going to post-op with you. I'm going to go ahead and give you a bed bath. Yeah, they don't offer that, do they? I'm going to give you a bed bath, or if you have enough energy to go to the shower. We're going to stand up and give you a shower, okay? A nice warm shower. Then I'm going to help you get back in your garments. If your other garments, of course, they're going to need cleaning. I'm going to make sure we get that from Walmart or somewhere close in the vicinity while we're out pre-op day. And I'm going to go ahead and get everything it is that you need so I can go ahead and hand wash everything, okay? So we on day 3. I didn't prep your food. We getting up walking periodically. I'm going to have you on a schedule. I'm going to have you on a schedule. Before I leave the next day, which is the 4th day, before I leave, if I'm going to go ahead and still prep your breakfast for you and give you your medicine. If you need another bed bath right before I leave, I'll go ahead and do that as a courtesy because I know how it is. I was once a patient. I'm getting ready to be a patient again. And I was a patient 2 times before that, okay? So I'm going to go ahead and administer and provide you another bed bath. You get what I'm saying? Put you on some clean compression socks, clean gown, help you get into, if you want to know the proper way on how to put your foam boards on, as well as we also are going to get some diapers. If you need diapers, if you happen to start your cycle, we're going to take care of all that, okay? Just let me know if you feel like it's coming down or whatnot, okay? I'm on live. I'm on live.
I see you on the phone.
So, needless to say, yeah, that's exactly what it is that we're going to do, okay? Let me see what else. So yeah, that's basically it when we cover that. Now, let's get to the nitty-gritty. What is this I'm hearing about another mandate? What is this I'm hearing about? This better be aroma. So basically, gosh, I don't know the name of, hold on, I'll be right back. Okay, y'all, I'm back. Why the whole time I was talking for a good 10 minutes and didn't even press start on the video? So anyways, I went back and I went to go look or whatever. It's Goals Plastic Surgery, 305 Miami. So basically, y'all know that Goals is in Miami, Goals Plastic Surgery, and I believe they're affiliated with New Life Plastic Surgery, and New Life is affiliated with Vixen. So like the email was saying, go back, look at your contract real good. I don't care if your surgery is next week. If your surgery next week and you flying in, call. I will call just to verify. I will call just to verify that my price is what my price is. And then y'all know income tax time is coming. So prices are rising. Prices are rising. What else? What else I had to tell y'all? Yeah, so a little birdie in my ear was telling me that Dr. Shanklin, he been getting out of there wee hours, like 2, 3 o'clock in the morning, doing surgeries. And that bring me back to say, my last surgery with Dr. Cannon, I told that lady at pre-op, I say, ma'am, and this is for all of you ladies that it's your first time or it's your second time, when you go to pre-op, you do have the opportunity to tell them that you want an early surgery, because either way it go, you got to get in and out. And I don't want to be number 10, 11, 12, 13, 14, 15. No, I want to be in the top 5, okay? I want to be in the top 5. What else? So yeah, when I go to pre-op, I'm gonna make sure that I let the lady know, the consultant lady know, who's doing my little paperwork. I'm gonna say, can you write on that chart on the front of that folder, early appointment? I need a 5:30. I need a 5:30 a.m. please. 5:30 a.m. please. 5:30, 6. I need, yeah, one of them. Yeah. Dr. Shanklin, me please. So yeah, so I pretty much covered my concierge services. I'm starting a little briefing on this mandate stuff. You know, I got to find out some more information about this. Now, if you just getting a Tummytuck, or if you just getting Lipo 360, like I said, or just something basic, it does not apply. Or like breast, like what I'm getting, augmentation, it does not apply. It's only applying to the BBLs. Y'all, I got to Excuse me, y'all. I am so sleepy. So it only mainly applies to the people with the BBLs or whatever. It's not applying to the other procedures. So, I mean, yeah, that's basically it. What I had to come share with you guys. I'm trying to see now. A lot of you have been inboxing me and inquiring a lot on like how to reach your coordinators, and y'all feel like everybody is unorganized, and trust me, I get it. Hold on. Let me tell y'all something, okay? Let your cousin tell you something. I do not work for Vixen, okay? Let me say that loud and clear. I do not work for Vixen. I do not work for Vixen. Because y'all be inboxing me saying, do you have Dr. Trigg's main number? Do you have Dr. Cannon main number? Y'all, trust me, I get it. For the ones, if you feel like that they didn't do something right and you trying your hardest to get in touch with the doctor, let me tell you something. 9 times out of 10, depending on how the doctor is feeling that day, depending on who you left a message with, and if it's not life or death, you're not talking to that doctor that day, or probably not the next day. Okay? And a lot of y'all, some of y'all been already flew back home. I mean, I get it. Like, if that was me, if I feel like Dr. Cannon messed up on one of my flanks or anything like that, and I'm trying to reach him and I can't reach him, I'm gonna be like, let me tell y'all, I'm gonna be blowing up their phone, like literally blowing up their phone. Like, no. So y'all, I understand, but I want y'all to understand. I don't work for Vixen. I do not have Dr. Cannon back number. I do not have Dr. Trigg's back number. I wish I had his back number. And I do not have Dr. Shanklin. And I sure don't have Dr. Shanklin back number. Because his sidekick, that wife, no. She gonna be like, this is Dr. Shanklin's wife. Whatever concern you're having, you can discuss it with me. Yeah, the sidekick. Yeah, I don't think Dr. Shanklin's wife is going for that. So, y'all, I don't work for Vixen. Only thing I try to do is bring y'all information that's given to me that's revolving around Vixen, as far as like important tips and topics and stuff like that or whatever. And my experience with handling with the different doctors. I have not received any services from Dr. Trigg's. But I can give educational advice on the type of service that Dr. Cannon offers, or what I was given from Dr. Cannon, or what I experienced, getting ready to experience with Dr. Trigg's. I mean, not with Dr. Trigg's, Dr. Shanklin. So, yeah, that's pretty much it. But like I said, congratulations. Before I end this video, I got to say congratulations. Congratulations to all of my cousins that recently just had surgery this month. Y'all been sending me pictures, and baby, y'all look good. Y'all looks good. Now, let me try to cover base real quick. Let me try to cover base real quick. Okay, so I don't want to ruffle any feathers or anything or whatever. Because, you know, a lot of people, we have some people on this channel that are in the bushes. Yeah. They don't even put a thumbs up, and it's okay. But I get the engagements. You know, by you watching my videos, I still get the engagements. So I really thank you. You're supporting whether you know that you are, but you are. So needless to say, we have a lot of people that, and I keep emphasizing on this topic because it don't really bother me, but it bothers a lot of my cousins. And like I say, when somebody bothering y'all, it's bothering me because we family. You get what I'm saying? So I'm about to cut straight to the chase on this one, okay? Then I'm just to let y'all go. If you don't have nothing nice to say, if you don't have nothing nice, we in 2023. This is 2023. People are having surgeries, okay? People are living their best life with you or without you. Period. Point blank. Okay? And I don't know, like, I just don't get it. Like, I just don't get it. Like, with some people, like our people, like us, like, I just don't get it. Like, again, if you don't have nothing nice to say to a sister or a cousin or a doll that's going through this journey, don't say nothing at all. Everybody isn't as strong as the next person. Everybody isn't as encouraged. Everybody isn't as encouraged enough as the next person. And you know, it takes, like they say, it takes a village to raise a child. It's taking this whole group of people that's inclined in this group to be supportive for one person. You get what I'm saying? So, like, you may not have somebody that you can just call and get supportive advice from. Or you may not have that one person you can just text and be vulnerable to, and they're going to come back with some positive some positive feedback to you, right? So basically what I'm trying to say is, I had a doll, not just one. I'll say I had a few lately. I don't know what's going on. Like, just stop. Just stop. I had 2 recent events, and I'm not going to get all in detail or whatever. But all I'm going to say is, everybody that you think that's for you is really not for you. Everybody that you think that's for you, they're really not for us. They want to mimic. They want to be judgmental behind your back. They want to discourage you. And they're jealous and envious. It's a lot of people. And I mean, that's in everyday life. But I just feel like, if you're supposed to be my friend, you're supposed to be a close loved one or whatever. If you're not supportive with the surgery journey, don't even speak up on it. I don't need your advice. She don't need your advice. How one minute you for me, and then the next minute you talking down on me after I come out of surgery. But leading up to surgery, you was like, oh, girl, yes, da 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 da. And then after I have surgery and you see my results, you got something negative to say. Or you catch ghosts and you don't have nothing to say. But you supposed to be my close friend. So I just feel like, be weary of people that you share your accomplishments with. I know that's kind of like, that's kind of harsh a little bit. I would say just protect your energy. Protect your energy. You know, stay mindful of certain things that you share with people. Stay mindful. Because your walk in life, your walking journey isn't for everybody. That because some people look at us and be like, and I say us because, baby, I'm all about this surgery thing, okay? Surgery gang, okay? So it's just like everybody not built the same. And I done sat in the room, a group of people that sat here and they would be like, oh, I don't see how some people go and have surgeries. Why not just go to the gym? But come to find out, they wanted to have the same surgery, but they couldn't. So because you couldn't, you trying to talk down on me. But if you could, you would be riding with me. Is that? No. I want people around me, whether they can have the surgery or not, still be supportive. If you cannot be supportive, just move around. 2022 not too far behind us. You can head back that way, baby, because I'm moving forward. 2023, yeah, we glowing. We getting fine. We know, period. Whether we working out in a gym or not. We're still getting finer. Even if you a gym rat, that's your journey, and people are gonna hate on that too. You know why? Because you have the motivation. You get what I'm saying? It's like we all going in the same direction, but we going in different angles of it. You get what I'm saying? We going in the same. We're gonna end up at the same finish line, but we're going in different directions, or we're going in different angles. You get what I'm saying? Because you probably make a left and then take the back streets. I probably take the main streets. Then she right here probably jump on the freeway. Her right here jumping on the beltway. You get what I'm saying? But at the end of the day, we're going to meet up at the finish line. So what I'm saying is, you can have a gym rat and you can have a plastic surgery rat. I play both fields. You get what I'm saying? No gray area. No gray area when it comes to me. I'm an open book. I let people know what I want them to know. But at the same time, I let people know what they need to know. You get what I'm saying? Not to benefit me, but to help the next sister down the road. You get what I'm saying? Because I just feel like, even at some of these recovery houses, they're not going to give us the type of treatment that we deserve. That's why I say with my benefit package, I'm talking about my benefits. With my concierge package, they not at these recovery houses. They not bathing you. And I didn't stayed at some. My last recovery house, I paid some racks. I didn't get no bath. I bathed myself. Okay, I bathed myself, and I had a BBL, and I was in pain. Even when I got home 4-5 days later, I was still in pain. Okay, so I mean, we just have to be mindful as far as like, do your research, Not only that, be mindful on who you sharing your journey with, because your journey is your journey. You get what I'm saying? If this is something that you want to do for yourself, even though you probably feel kind of discouraged at times, you probably feel like sometimes like, oh, this is a waste of time because maybe your labs ain't come back how they were supposed to come back. But at the end of the day, labs don't lie. It's up to us. And I was that one person. I used to be mad at the labs. I was mad at the labs. Then I had to revamp, and I had to go back and look at my scratch sheet and like, oh, I didn't do this. Or maybe I can incorporate this, and maybe I can stop that. You have to stop drinking alcohol. You have to stop smoking nicotine, weed, hookah, all that. I know y'all see I do it on my stories sometimes, but trust me, I'm about to stop smoking hookah. Like literally, they say you can stop drinking alcohol 2 weeks prior. I'm about to stop that at the end of this month because my surgery is less than 50 days. Okay? So, no, wait a minute. What's this? January, February. It's 28 days in February. Yeah, so yeah, less than 50 days, and it's 30 days and da-da-da. So, yeah. Can't nobody make the next step but you. Can't nobody put forward the effort but you. Like I said, y'all, you got here this far. Y'all have made it this far. If you're on my channel, it's either because you already had surgery, you're getting ready to have surgery, maybe you've been contemplating and thinking about having surgery, or you just like my vibes. You get what I'm saying? And it's okay, because I follow a lot of different channels and I'm like, oh, I would never do that. But the person is entertaining, they're educating, and I love it there. Okay, so I get it. So like I said, my channel, I come to you guys so you guys can have a platform where you can relate. I done already been at the phase where I done been depressed. I done been at the phase where I've been discouraged by the closest people in my life. Discouraged. And I want to say not all of the people that was discouraging me were negative people. Because let me tell you something. It's a difference, okay? It's a, just because, hold on. I just touched at a good point. Just because a particular, if you know that, let me tell you, if you know that this person means well and this person really has your best interests, you get what I'm saying? Your best interest, and this person is really for you, like a parent or even maybe a sibling. I know a lot of people aren't close to their siblings, and some people really aren't close to their parents. But if you have that one friend or that one sibling, or, you know, anybody that's telling you, are you sure this is a good idea? Are you sure this is really what you want to do? They're really not trying to contemplate your decision. They just want to make sure you feel comfortable in what you're doing, your next step. They're not being negative. They just trying to not only like find out for sure, are you comfortable with it, but also probably trying to reassure themselves that you're going to be okay, because they are really, really genuinely concerned about you. So recognize the difference of a person that's truly there for you and then a person that's speaking negative and that's not really there for you. Okay, toxicity energy. Okay, and we don't have time for that. And I don't care, it can be somebody you know for years, it could be somebody you work with, and I get it, because it's like you going through this excitement moment in your life and you want to share it. Okay, you want to scream it to the top of the ceiling. But look, some people, they can keep it to themselves, because I done watched a lot of videos, and one girl, she was wailing a Dior and she was like, y'all, I just dropped this video, so if you're watching this video, I already had my surgery and nobody even knew that I was having surgery. The girl said nobody knew that she was even in the DR. Okay, they thought she was, I don't know. They didn't even know she was in the DR, okay? She said she had never been to the DR. Okay, she went out there and got a whole mommy makeover, and baby, when I tell you, she was looking good. I say, I wish I had the courage to go across that water, but I just, cousin ain't going across. I can't go across. Look, I went to Miami for a BBL, and I was, y'all seen the video, okay? Y'all seen the video. Now, I went across the water and got my teeth done, and I was ready to get my ass home, too. Okay? I was out there 2 days too long, okay? But, yeah, it's just, it's the motion of the ocean. You know, just go with the motion of the ocean. If you done passed your labs, you done got clear, your clearance is good, your hemo is good, your BMI is good, you already put in your FMLA or your PTO at work, you got a good support system, you found you a good recovery house, or you have somebody coming with you that's very, very reliable, that's not going to cancel on you right before, you get what I'm saying? Then you are good to go. Say you a prayer, think positive thoughts, do what it is you need to do, and take care of yourself. Because at the end of the day, you can pay, you can pay all the nurses you want to pay, but baby, they're not gonna be with you every day. Once you get home, it's back to reality. Whether you got kids or not, it's back to reality. Okay, I just want you all to really take care of yourself. Make sure you're taking your vitamins. All of this falsification that I've been hearing about, people doing falsifications on their labs and stuff like that. What are you gonna do when the truth come out that you falsificated your labs and stuff like that, and they trying to pin it on the doctor? They trying to pin it on the doctor. You lost all this blood, you in ICU, or you at the hospital, and you getting blood bank shipping blood and all this stuff because you falsificated your lab. I wouldn't want to falsificate my lab work, because guess what? I want to make sure that, Lord's willing, I wake up out of surgery, because I got kids to get home to. And even if I didn't have kids to get home to, I want to get home to this body, okay? Shoot. But yeah, I just want y'all to stay encouraged. Y'all know I'm crazy, but I am crazy about y'all. Like, y'all be having me worried. Like, some of the stuff that y'all be sending me, like, it be taking me a while sometimes to respond, even though you see I read it, because I be getting in my feelings because I do not like how y'all are being treated by people that are close to you. And I don't like how y'all are being treated by some of the coordinators and stuff like that. Like, that stuff really be bothering me. Like, I really wish that I did have some type of connection with Vixen, so I can really get to the nitty gritty and figure out, like, some of these coordinators, like, y'all do not have to talk so aggressive. Y'all don't have to rush these women off the phone like that. They're just asking questions. You get what I'm saying? Like, you wasn't rushing them off the phone when you took their deposits. You wasn't rushing them off the phone. You was quick to send that little link. But when I want to call and verify if you received my lab, so if I want to call and verify if I've been cleared or not, it's hard to try to reach somebody. And that's just not right. That's just not right. And if anything, like, when I get up there to Vixen, matter of fact, like I told y'all, like, I really do want, I don't know how I'm gonna be able to do it, but y'all know I'll be trying to make moves, okay? I want to, like, try to interview, like, one of the consultants, and I want to, like, try to interview one of the coordinators. Just get their aspect on, like, their everyday life. And, you know, because it's always another side of what's going on. I'm pretty sure, yeah, they are overwhelmed as well. They have a call center, I believe, as well. And they're dealing with millions and millions and millions of women. And I know y'all probably say, they don't got nothing to do with me. I pay my money, so when I call, I need to be able to get in touch with such and such and such and such and such. I get it, cousin. I know, girl. But yeah, I'm gonna go ahead and wrap up this video. Like I said, y'all know how to reach me. Follow me on TikTok, Krystal Crosby 1. Follow me on Instagram, sexycaramel_Krystal, and that's Krystal with a K. Yeah, don't forget to thumbs up this video. Hold on. This video was 40-something. Like, I brought y'all 40-something minutes. Come on. It don't cost you nothing. Thumbs up your cousin. Y'all know I'm bringing y'all along. It's supposed to be countdown. It's about to be countdown. Like, literally. So, the beginning of this video, I don't know if I was able to add it at the beginning of this video. I don't know. But hopefully we'll see. Because I believe it kind of cut off a little bit. But originally I went to go try to get my B12 shot. And I wanted to bring y'all along so y'all can see what's the B12 shot and da-da-da-da-da. And break it down in layman's terms and stuff like that or whatever. So y'all can really see what a B12 shot is and where they administered it at and how much it costs and blah, blah, blah. But yeah, I am getting ready to start back that up. I'm going to start taking that, like, going to get that done like every 2 weeks, where they technically only let you come every 2 weeks or whatever to get it done or whatever. But when I went, they were out of needles. So I have to find me another location. And hopefully I can try to make arrangements to go get that done this week. Okay. Other than that, I've been taking my vitamins and stuff. On my next video, I'm gonna come and show y'all the vitamins and stuff that I've been taking. I got me a blender now, a new blender where it's mainly like a smoothie, like a juicer. And so yeah, so I can start getting this beetroot rolling. Okay. Other than that, yeah. So yeah. It's your cousin Krystal, and don't forget to thumbs up this video. Oh, share your cousin video. Don't act like that. Happy New Year, and y'all know I love y'all.
Doctor, my wife just got plastic surgery, and I have no clue how to recover her.
Let's break it down. So, your wife's having liposuction. These are some key things that we should focus on.
What do you expect after 24 hours after liposuction?
So, you can have a lot of bruising, a lot of drainage, like we talked about. She may not have much of an appetite to eat. Some patients do, but most patients don't. But just make sure she's drinking lots of fluids and just helping her get around to the bathroom and things like that. It's not uncommon to be a little lightheaded right after liposuction. If she's feeling in pain, just make sure she's taking her medications on time for her pain medication, also her antibiotic, and even her nausea medicine, because that may be why she's not eating too. And that's all normal to have, especially within the first 24 hours, even up to 48 hours after surgery.
So how long should I drive for her?
So it depends. As long as she is off the narcotics, when she becomes off the narcotics and she feels comfortable to where she can swerve to miss something if something were to jump out at her without wincing in pain, then that's my criteria for someone that can go back to driving. Until then, you're the chauffeur.
Okay. Thank you, doctor, for all your help. I will try my best to see what I can do.
All right, no problem. So remember, recovery is not super quick. It takes time. Swelling takes time to go down. So just continue to be patient with her. You know, ask questions if you are alarmed. You know, give us a call. We'll be happy to help. With all that being said, if you're interested in any of these procedures or any procedures I perform, please click the link.
Like calling enough. I'm in the mood to fuck something up. Better fucking something. I need some drink in my cup. Hey, I'm in the mood to fuck something up.